Good morning, good afternoon and good evening everyone, and thank you very much for coming to our webinar this month, which is titled The Role of Local and National Actors in Linking Humanitarian Cash and Social Protection in Response to the COVID-19 Pandemic. My name is Lois Austin and I work with the Grand Bargain Cash Workstream subgroup on linking humanitarian cash transfers and social protection. We'll start the webinar today with our usual poll to try and give us an idea of who's joining us, and this will also help our panelists to know how to tailor some of their interventions and comments. So please select now if you're a social protection actor, a humanitarian cash actor, both of these, or neither of these. And we'll let that run just for another few seconds. I'll count down from 4, 3, 2, 1, and let's see if I can see what the results are. Okay, so we have the majority of people participating are social protection actors, 48% of the audience, 33% are both humanitarian and social protection, 14% of the audience are humanitarian cash, and 5% don't fit into any of these categories. Thank you very much for participating in that. So just to give a little bit of an overview before we get into the substance of today's webinar, the overall objectives of the subgroup, which was formed 1 year after the World Humanitarian Summit in 2016 and is co-led by UNICEF, DFID and the IFRC, include firstly to understand the scope of efforts underway on strengthening the link between social protection and humanitarian cash transfers. Secondly, to seek opportunities to engage and add value to the current discussion and efforts in this area. And thirdly, to initiate dialogue with development stakeholders on preparedness and response actions needed to support the links in times of crisis. And today's webinar really responds to all three of those objectives, and specifically the issue of reinforcing the dialogue and knowledge sharing between humanitarian and development stakeholders. This area of knowledge management work is led by UNICEF and it's funded by DFID. And in addition to the monthly webinars held by the subgroup like this one, we're looking at other ways to try and share knowledge and learning. For example, we produce a weekly newsletter, the Links newsletter. We also have a live and editable Google map mapping the links between humanitarian cash transfers and social protection responses to COVID-19. And the link to this Google Doc, you should see it in the chat box on the right-hand side of your screen. And I would really like to encourage all agencies across the globe to go into this live Google Doc and update where you can the information, and then we can get cash working groups to verify that information. But please do check it out and see if you can find the time to update that, so that it's a really useful tool for practitioners. And we're also in the process of developing a number of case studies to highlight experiences from COVID-19 interventions where links have been made between humanitarian cash and social protection. And if you want any more information on how you could contribute to those case studies, please contact me directly. And again, you'll see my email in the chat box to the right. We are also linked to socialprotection.org's COVID series of webinars. And just to highlight their upcoming webinars, the next one will be on Tuesday, the 18th of August. And it's going to be about the potential role of social protection to respond to the shadow pandemic of violence against women and girls during COVID-19 in the Indo-Pacific. And on Thursday next week, they will host another webinar about the profiles of social protection systems of Nepal, Sri Lanka and Afghanistan prior to COVID-19 and provide a snapshot of responses to the pandemic in those countries. Just to introduce the speakers for today's webinar, and we're really thrilled to have 4 speakers from 3 different countries and contexts who are willing to share with us their experience in relation to linking humanitarian cash and social protection in response to the COVID-19 pandemic. From Madagascar, we have the honour to be joined by Madame Patricia Rakotonarina, who is the Principal Secretary of the Ministry of Population, Social Protection and Women's Promotion. Secretary General Patricia has a master's degree in risk and disaster management and has played a central role in designing and implementing the country's social protection response to COVID-19. From Swaziland, I have the pleasure to introduce firstly Mr. Nhlabatsi, who is Secretary General of the Baphalali Eswatini Red Cross Society, or the BERCS. He's been Secretary General since 2013 and has some 30 years of experience working in the humanitarian field, mainly with NGOs, and specializing both in agriculture and business administration. Also from the BERCS, we are lucky to be joined by Mr. Siphelele, or KB Mkhonta. KB is the National Society's National Disaster Management Coordinator, and he's been with the BERCS for the last 4 years, throughout which time he has been involved in implementing humanitarian cash transfer programs. KB's specific expertise, like the Secretary General, is in the area of agriculture. And finally, joining us from Albania is Mr. Ilija Zguri, who has worked for the last 9 years as Director of the Social Services at the municipality of Korça. Mr. Zguri is responsible for ensuring that all national policies on social inclusion and social protection are translated into local actions in his diverse, multicultural and multi-ethnic municipality. So before handing over to our 4 eminent speakers, just a reminder of the objectives and the structure of today's webinar. So the main objective of the webinar is to understand the role played by local and national actors in linking humanitarian cash and social protection in response to the COVID-19 pandemic. The webinar is going to provide us with the opportunity to hear from the 4 speakers that I've introduced, and they're going to share their very different experiences in the responses they've been involved in. We're reverting to a more traditional structure for today's webinar, which I hope won't put people off, but it seemed the best way to allow the speakers to present their practical experiences. So they will each speak for about 10 minutes using some PowerPoint slides, and then we'll have a Q&A session at the end. And the speakers will try and talk to us about the point at which there was engagement between humanitarians and social protection actors, and where this was made, or how it could have been made. They'll touch on decision-making processes in relation to collaborative action and how timely these processes were. We'll hear a bit about the stages and levels of collaboration, whether collaboration was made in the areas of policy, design, or implementation, or across these different stages. And throughout all the presentations, we'll hear about some of the key successes, but also challenges that have been faced in order to help us all in learning for the future. As I mentioned, there will be a Q&A at the end, but please do start posting questions as we go through. Please try and indicate which organization you're from and what your name is, if you're linked to an organization. And if your question is for a specific speaker, then please do highlight that. We would also encourage you to join the Social Protection Responses to COVID-19 online community, which you can find on the socialprotection.org website. And there you can also have follow-up discussions in relation to the webinar. So as we already know, the COVID-19 pandemic has put the spotlight on an existing paradox, that many countries with the greatest need for adaptable social protection approaches have the lowest capacity to address that need. The public health responses to the pandemic have often included lockdown measures which have resulted in loss of income and loss of livelihoods opportunities, creating an increase in the number of people in need of urgent as well as medium and longer term assistance. At the same time, the economic crisis has impacted government financial resources to address the pandemic as well as its side effects. And today we will hear from speakers from the 3 different countries mentioned, who will highlight how humanitarian actors and government social protection systems have worked together to try and address the unprecedented challenges presented by COVID-19 through the provision of collaborative approaches and the provision of cash-based assistance. The speakers are going to give us insights into how social protection systems have been scaled up and adapted during the crisis through linking with humanitarian actors to address increased needs. And they will also discuss how these efforts have been coordinated. It's hoped that learning from the shock responsive approaches highlighted can be used to inform the building of strengthened social protection systems which are able to better respond to future crises. So I'm going to introduce our first two speakers. So Secretary General Nhlabatsi from the BERCS and KB, who's the Disaster Management Coordinator. And they will shed some light on the role of the Red Cross in Swaziland and some of the coordination efforts with the NDMA there. So over to you, Secretary General and KB.
KB Mkhonta, the Disaster Management Coordinator for Baphalali Eswatini Red Cross Society. First of all, I will just give a context or a brief background on the involvement of the National Society on the humanitarian cash transfers, and also then the linkage to the response that is ongoing with regards to COVID-19, for especially with the cash transfers. I will say first and foremost, the National Society has been involved in cash transfers since 2016-17. We experienced drought in the Southern Africa. So part of the response, the National Society that he opted for was the cash. So in terms of the country, we faced with the food insecurity due to droughts, and also we still dealing with HIV and AIDS. We're also looking into how we better respond in terms of the food security needs. So with regards to, okay, sorry, Louis, the next slide. Yes, so I was saying with regards to the kind of responses that had been used, normally it was the general food distributions. So in terms of resources around the general or the in-kind food distributions, you'll need more resources to cover that. In terms of social protection, before COVID, it was divided into many, I would say, types, because others were getting it on a monthly basis through banks, but others were getting it quarterly with the cash in hand or cash in envelopes. So the cash in envelopes, in terms of the social protection, it is implemented, or the social protection is implemented under the Deputy Prime Minister's Office, the Social Protection Department. So, but then there were challenges with the high cost in terms of personnel and logistics to ensure that all the beneficiaries, especially the elderly, and those people who live in with disabilities. So in country, the National Society together with WFP and World Vision have been doing the cash transfers ever since the 2016 and 17 drought. And also our coordination is through the National Disaster Management Agency, NDMA, whereby the National Society has played a major role in terms of advocating for cash transfers over in kind. Then the next slide, please. Yes, then with regards to the COVID-19 and cash transfers, what happened was that the National Society was implementing a cash transfers program by the time the COVID-19 pandemic struck. Then what happened was that we went into a lockdown as a follow-up to the precautions in terms of the health precautions, and also some restrictions were there put in place in terms of meetings and stuff. So we were not allowed to have a much more gathering beyond 20 people. And then in terms of the social protection, through the Social Protection Department, the government inquired from the National Society about the possibilities of using the cash transfer methodology to pay the elderly and the disabled from the National Society, which the National Society gave a green light. And in terms of the changes that were then effected was that the elderly grants during the, I think, around March, it was then paid through the cash transfer, which was mobile money, instead of using the cash in envelopes. And then the other thing that happened was that in response to the pandemic, the government also took initiative to support in terms of food security the country, where about 300,000 people, after a needs assessment was done, discovered that they've been hit hard by the COVID-19. So which necessitated some response. And then within that response, it was inquired from the National Society which method could be used. And then the cash transfers was the opted method. The National Society was also engaged in terms of beneficiary targeting and registration within the COVID-19 response, where it was covering part of the country, I think 2 regions in the country, and a total of 13, we call them constituencies, or we can say that some districts sort of. And then as of the 10th, we had already covered all the 59 constituencies in terms of first round payment for the COVID. And then currently there are ongoing verifications for the second round payment with regards to the COVID interventions. The next slide, please. And then I will hand over to the Secretary General.
Good morning to all of you. Nhlabatsi is my name. I will just highlight on the role of the National Society in advocating for the cash transfers in the country. Well, my colleague here has highlighted quite a number of things. Of course, the National Society also got some assistance, probably training from other national societies like British Red Cross, Finnish Red Cross, who helped us a lot, giving us capacity so that we are able to handle cash. Now, the role of the National Society here has been very simple, but sometimes challenging. We have done quite a lot of lobbying to many organizations and important people in the country, including members of parliament, about the use of cash as opposed to the in-kind services. We also had several meetings with the National Disaster Management Agency and the Deputy Prime Minister's Office, where the Social Welfare Department is sitting. In those meetings, we seriously engaged on the possibilities of using cash as the modality. We also, as a national society, like KP has mentioned, that we have been involved in cash transfers since 2016. So we have been disseminating information to key stakeholders, including members of parliament, government officials, regional administrators, and many others, including NGOs, so that they are aware that cash can be used as an alternative. So we also invited the government to some of the sites where we were doing cash disbursement, so that they may observe how it is done, ask relevant questions, and we even ask the beneficiaries so that they may have first-hand information about the use of cash. We were conducting lessons learned for every cash disbursement project which we're doing, and we're inviting all these key stakeholders so that they may know and also get it from the beneficiaries and other stakeholders on how the use of cash can be done even in the country, and how people feel about it. The National Society here was not alone, but we were working closely with the UN agencies such as WFP in helping us advocate for the use of cash in the country. Therefore, it has been a journey, but we are very happy that as we speak now, the government of Eswatini is using cash transfers in this COVID-19 to assist people who are impacted by COVID for food security activities in the country. I think I will stop here for now. Our time is up. Thank you very much.
Thank you very much, Secretary General Nhlabatsi and KB, for that really interesting overview of some of the work of the National Society in Swaziland. And I think some of the important points that have come out there, which are often easy to forget in the height of a crisis, are the importance of the advocacy and lobbying work that you undertook in collaboration with WFP at really the highest levels, parliamentary levels, and throughout different levels there, which has really, I think, been beneficial. I think as well, you mentioned some systems alignment with the government switching from cash in envelopes to using mobile money systems. So the government aligning actually with humanitarian cash approaches, which is a really interesting thing to see. And also what you mentioned at the end about sharing and disseminating the lessons that you've learned from the approach, because it's using those lessons that we can build stronger systems for the future. So I'm sure that there will be some questions for you at the end, but for the moment, thank you very much from Swaziland. We'll now go to Madame Rakatonarina, the Secretary General of Madagascar's Ministry of Population, Social Protection and Women's Promotion. Madame Patricia will provide us with an overview of the Ministry's cash-based social protection response to the pandemic, highlighting some of the successes and challenges encountered in linking with both humanitarian and development actors such as the World Bank, UNICEF, WFP, the EU, ACF, CARE, HI, SOS, and the Red Cross of Madagascar to implement the response. So, Madam Patricia, over to you. Thank you.
Thank you so much, Mrs. Lois, to introduce me. Well, I'm here to share the experience of Madagascar about the link of a social protection program and humanitarian action in the context of COVID-19. First of all, let me talk about the structure. Please, next, please. Let me talk about the structure in place and policies to the social protection system in Madagascar in order to improve the coordination of the government action in Madagascar, including social protection action. Different platforms or groups have been implemented and co-led by the government department who is concerned and the representative of the partners. The main goals of the platform are to give a space to discuss between all the actors of social protection, to harmonize social protection actions, to align programs and projects and all support, and to share experiences and give recommendations. The National Protection Group is both led by the ministry in charge of social protection and UNICEF. The National Social Protection Group is composed by 4 subgroups, but that we can see in the screen today. I will most talk about our experiences in the first subgroup, emergency and cash transfer. Cash Working Group in Madagascar is a good example of a collaboration between social protection and humanitarian actors under the government responsibility. The Cash Working Group is co-led by 2 government institutions, the Ministry in charge of social protection and the National Agency for Disaster Response with technical support from UNICEF. As I said, The cash working group is a subgroup of a broader national social protection group, which covers all aspects of social protection strategy in the country. Members of the cash working group include government agencies, municipality, UN agencies, World Bank, non-governmental organizations, civil society organizations, and the development partners. We meet once a week since the beginning of the COVID-19 crisis, if it is once a month in normal times. Next, please. Next, please. If I talk about legal tools, you can see in the screen the law and the decree for the social protection. And we have also law and the decree on the national risk and the disaster management policy. About policy framework, the national social protection policy was validated and implemented on 2015, and it gives our vision and goals since 2030. Especially for shock responsive social protection, it is embedded in the national social protection strategy, and the humanitarian cash assistance should be implemented via the national social protection system according to this strategy. On operational manual to respond to crisis via an expansion of the national social protection system has been elaborated and validated by members of the cash working group, and it defines clearly criteria on when or how to trigger expansion on the social protection during a crisis. For the implementation, different MOU has been signed to ensure collaboration between humanitarian and development actors. And the ministry in charge of social protection and National Agency for Disaster Response, as you've seen in the screen, has since signed a MOU. The MOU also is been signed between ministry in charge of social protection and the National Agency for Disaster Response. The MOU, one MOU between the ministry in charge of social protection and the National Government Agency, FID, who executes the program. And one MOU is signed between the National Agency for Disaster Response and the National Government Agency. Next, please. In terms of social protection, the response of the government is food distribution and price control in the market in all areas which touched by confinement, because of the Malagasy population is poor and a lot of them try to search food day by day. For the cash working group, national strategy to respond to COVID-19 is elaborated and validated by the member of cash working group in March, and it defined the goal that it's for to improve incomes of poor households who lose temporarily their job area, which is touched by confinement. In this strategy, defines priority area that initially pre-urban areas when expanded to new areas based on needs. The targeting criteria, the amount of transfer, and the length of transfer. The project is calling Tuskafame or filling the gap. This strategy is adopted and starting in April by different actors. First of all, the National Social Protection Program, FID, with geographic expansion in urban area. not covered by the pre-existing social protection system. It's supported by World Bank and UNICEF. It's adopted by humanitarian actors like WFP, UNDP, ACF, CARE, Red Cross, SOS, and Handicap International. In this strategy, the geographic repartition is adopted. The geographic repartition of intervention area among the feed and the other humanitarian actors to complement each other. And in April, we did the first payment to 240,000 as well. On July, we do the second payment, and also the expansion. In the expansion, the first payment to 7,000 new as well in a new area. A subgroup of cash working group developed common monitoring and evaluation system with the same department numbers on July. And the complaints and grievances are managed by the municipality and the humanitarian actors who is implementing the project. On August, the expansion of 6 new areas is implemented by WFP with 80,000 new beneficiaries. And the monitoring and evaluation is started in the municipality of Antananarivo. In addition of that, the cash working group meet every week to identify the recovery action. And for the government, they do a general census of Antananarivo household. Next, please. For the Tuska famine, the strength of the program is the elaboration of common tools used by humanitarian and government actors. We are used a common targeting system. We are harmonized registration questionnaire, unique registration process done by the WFP and FEED, and the list of eligible households shared with the other actors based on their intervention areas. We developed and implemented a common monitoring and evaluation system, and we developed two common communication strategy. Next, please. We had a good lesson learned about this COVID-19 response. First of all, is the good collaboration between humanitarian and social protection actors to be replicated for other type of crisis. We are also use a unique strategy and common tools to help to avoid fragmentation of response. And we have to coordinate better with other programs and maximize the impact on household. We working together to avoid the duplication of the cost. For example, about the registration is done by two actors and share with others, leading to economy of scale. And the last, it is this project Tuska famine with an opportunity to build on this emergency program and develop a longer-term resilience strategy for urban area with the cash working group members. So thank you so much for hearing me.
Thank you very much, Madam Patricia, for a really interesting example of some very strong collaboration between the government and between development and humanitarian stakeholders in response to the pandemic. And particularly interesting about the use of common tools and common messaging. As well as at the levels of working groups, having an emergency and cash working group as part of one of the Social Protection Ministry's sub-working groups, but also ensuring that the cash working group has validated issues such as the targeting approach and the value and duration of the transfers in the response. We'll now move on to our final speaker, Mr. Elias Guri, the Director of Social Welfare of the Municipality of Korça in Albania. Mr. Zguri will share with us an example of a temporary horizontal expansion of the municipality's social safety net system in light of the pandemic, which has been supported by UNICEF. Ilya will be speaking with the support of simultaneous translation. So whilst we will be able to see him, please be aware that the voice that you hear will be that of a translator. So over to you, Ilya. Thank you. I'm just unmuting myself. Alketa, are you able to see if we can switch on Ilya's microphone, please?
Yeah, no, I'm not able, actually. Hello to all. I was texting to Ilya. He was all the time online, so I don't know either.
Here is Ilya, so I will hand over to Ilya now. Thank you.
Good afternoon, everyone. First and foremost, I would like to thank the organizers for inviting me to present the work of our small municipality in helping vulnerable families and children during the COVID-19 crisis. In my opinion, this forum is a great opportunity to exchange our experience and learn from one another. Next slide, please. Korça is a small city with about 110,000 inhabitants in southeast Albania. Following the June 2019 earthquake in an area of the municipality, the crisis caused by the COVID-19 pandemic that was officially announced in March 2020 presented an unprecedented situation. Although our municipality includes a civil emergencies department tasked to deal with emergency situations, which did act during the earthquake, we were totally unprepared for the COVID-19 pandemic in terms of admin provisions, infrastructure, human resources, and the capacities to support families and individuals in a predictable and long-term fashion. We immediately called the social dialogue group consisting of local NGOs, donors, and institutions, which has been operating in Korça municipality for almost 2 years and is experienced in coordinating and cooperating with the municipality and other institutions in the area of social services and support for families and individuals in need. This group is an excellent forum to carry out social protection interventions for people in need, and it was our main partner at the local level. Next slide, please. The Albanian legal system provides for a centralized management of crises and disasters through a special law. The social protection law and strategy do not stipulate measures for responding to shocks and disasters. In the case of the COVID-19 pandemic, the law on civil emergencies was immediately implemented and the government took several measures. Intergovernmental committees were established and ensured the full coordination of this process associated with the setup of emergency centers at the municipal level and cooperation with the prefecture as the institution that coordinates cooperation among all local institutions. The government took prompt decision for the military forces to distribute food packages for about 600,000 individuals in need in the municipality. Material aids, food and non-food packages comprise the usual modality that is provided during crisis situations in Albania. For the first time in March 2020, the Albanian government allocated funds for doubling the poverty-targeted cash assistance and unemployment benefits, yet a number of families were left out. Despite such measures, the main burden of the pandemic was borne by the municipality, more specifically by social protection structures. In early March, we held the first meeting regarding the pandemic situation and measures to be taken for fulfilling immediate needs. We decided to constantly provide food aids and report on a joint database in order to enhance its effectiveness, avoid assistance overlapping, and increase the beneficiaries' number. The municipality established a network of 10 groups with leaders who covered the 3 administrative regions of the city and 7 administrative units of the village, consisting of regional leaders and social workers. They were tasked with on-site identification of families and individuals in need, identification of lone living elderly in need of services due to isolation, establishment of contacts with families who had never been beneficiaries of social services by that time, but were in need as a result of the difficult economic situation. In this framework, volunteer groups consisting of employees from various municipality departments and youth from the city were established. A hotline was immediately created for citizens who submitted their needs via phone calls. Considering the specific on-site situation, food aid was delivered by the municipal police. Everything related to the situation was new for us, and we needed time to organize and reach the final structuring. More often than not, we encountered difficulties due to lack of previous experience as well. These were the first interventions through which we managed to control the situation, provide aids, and set in motion governmental structures. Additionally, the mayor immediately turned for support to all international organizations in Albania. Next slide, please. UNICEF was the first organization that not only promised, but also provided quick, phased, and continuous support. For the first time in Korça municipality, UNICEF paved the way to pilot the money transfer program. UNICEF allocated the funds to Korça municipality for ensuring support to 610 families with minors and families that had not been provided any aid package or state financial assistance. UNICEF supported only 3 municipalities, namely Durrës, Korça, and Shkodra. The municipality designed the list of families in need, as long as they were not provided any other program of humanitarian cash by the Albanian government. The municipal council discussed and approved this list in the same way they would do with lists of other families that are provided economic aid. The program entailed one single allowance at the amount of 4,000 Albanian lek for families with 4 members or less, and 4,800 Albanian lek for families with 5 members or more. This amount was determined considering several decisions of Council of Ministers of the Albanian government regarding economic aid measures for special groups, as well as a recently approved DCM on essential food products for a family, that is DCM number 2 dated 24th of March 2020. Allowances were provided via postal services, which is the same system used for the economic aid. It was not easy. The delivery has not been completed as we speak, but it is the first time ever that cash modality is being used in Korça, and this is a great experience. Clearly, families would have benefited more from monthly allowances for 6 to 8 months, but what matters is the experience we acquired from this situation. This program showed that there can be horizontal expansion of social protection, and it also identified the steps to be taken and the number of difficulties for discussion. Next slide, please. I will list the steps in my speech as they have been discussed in a national meeting chaired by the Ministry of Health and Social Protection at the local and national level. Aids were mainly provided in the form of food or sanitary packages, with only a small part of them being humanitarian cash. Upon drawing a comparison between the two types of aid, we concluded that 1. Food and hygiene and sanitation packages are subject to the following steps: ensuring funds, obtaining the approval of the municipal council, procuring purchases, ensuring transportation, providing storage, loading, distributing aids through means of transport and people, managing risks posed to the staff in contact with beneficiaries, undergoing some sort of not so positive promotion and public dissatisfaction, as well as experiencing a time-consuming process. 2. Humanitarian cash is subject to the following processes: fund and beneficiary families determination, approval by the municipal council, such step can be accelerated, signature of a contract with the distributing entity, cash distribution via postal services or banks. Upon a 5-month situation analysis, we concluded that a lot of time, human resources, infrastructural means, and energy were employed in ensuring and distributing food packages. This slide shows that the difference is evident, and humanitarian cash distribution is advantageous in terms of time, human resources, and infrastructure. This is proven by the Ministry of Finance cash payments that are called war payments. In the past 6 months, economic aid beneficiaries and non-winning applicants have been provided 2 direct humanitarian cash through the bank in just a few days. Next slide, please. In conclusion, I would like to express my appreciation for the humanitarian cash model, which, in situations as the COVID-19 pandemic, requires simple, quick, and long-term procedures. Once the delivery is completed, UNICEF will support us with the post-transfer monitoring, but the first data from Durrës municipality and the messages from our families confirm that they use the money to pay for food, internet connection for children's online education, and medicine. Families state that despite being a small amount of money, it has been very useful in meeting immediate needs and relieving momentary stress. We hope that this model will be a breakthrough and that once and for all, cash payments will become part of policies and legal tools that regulate emergencies and social protection in Albania. For the first time, the Ministry of Health and Social Protection chaired a roundtable in July where a national and local dialogue was started on the need to reform the social protection system to respond to disasters and crises. Thank you very much.
Thank you very much, Ilya, for a very interesting overview of how you upscaled the system in Korça using the humanitarian cash model and so that your social protection system could benefit, particularly around targeting and delivery systems, and the importance of actually the recipient preference and the speed at which they could get assistance from the municipality. So a very interesting example of a horizontal expansion coming from Albania there. Thank you. So thank you for the questions that have been posted so far in the chat box. Please do keep them coming, and I see that some of them are actually quite long. So I'm not sure that we will be able to answer all the questions and sub-questions today, but we will provide some written responses to those, and that will be uploaded on the socialprotection.org website. So I wonder if all the speakers can put their cameras back on, because we'll try and divide the questions up throughout the speakers. And so I'm actually going to go first to KB and Secretary General Nhlabatsi for questions 3 and 4, which are really lengthy questions, basically asking about the whole of the National Society's cash response there. So let me just maybe pick a couple of the sub questions for you, and then if you want to respond to those or others. So this is these are questions coming from Raman Kumar in India, who asks, who were the recipients of the cash transfer program in Swaziland? I think specifically, was it the head of household? Was it women? Was it large families? So that kind of how is it targeted? And I think you may actually have something to say about the risks of duplication there around some of the transfers. So perhaps you could respond to that. And there's also a question about post-distribution monitoring and whether that's taken place. So it would be interesting to hear whether any post-distribution monitoring is done collaboratively with the NDMA, or how the results are shared. And then I might come back to some of the other questions, but let's stick with those two, and then we can come back to you. Thank you. KB, I think you're on mute.
Okay, thanks, Louise. Yes, saying thank you very much for the questions posed to us. In terms of the targeting, registration, and verification, yes, like I said earlier, the National Society has been involved in that one, especially in the COVID response. So what happens is that normally the exercise takes place at a community level, working with the community leadership, and we have a selected committee representing the different villages in the communities, which we call a relief committee. So the whole process goes from targeting, the selection, the registration, and then the verification. So for the National Society to ensure who gets into the final list, it has to be verified after the community has done its part. So in terms of who benefits, it is the household head, whether it's a woman or it's a man, but the one who is heading the household. So it's a decision of the household to say, we will register the women as a head in the household, or we'll register the man as the leader of the household. But preferably, we normally say the women, because they know the needs of the household, especially in the kitchen needs in the household, the food needs in the household. Then the other thing is that we do conduct post-distribution monitoring, both in the humanitarian and also in this one, social protection, through NDMA also being involved in terms of the post-distribution monitoring. So it is done to ensure that the money has been used for the intended purpose, and to check if there are any other concerns or questions coming up from the beneficiaries themselves, which can help us to better program the intervention. Then lastly, we also have a toll-free number or a hotline number, which the beneficiaries can call to register their complaints and feedback, which is managed by a third party. And the NDMA gets the information from the third party, and then it can action it on the social protection one that is ongoing. But on the humanitarian one, it was the National Society getting it from the third party, then taking action based on what has been registered as complaints or for feedback purposes.
Okay, thank you very much, KB. I noticed that there's a few other questions for BERCS, but we'll maybe come back to those in a minute. So there was a question about data management and data protection, which I was going to ask Madame Patricia to respond to. It's quite a broad question from Jean-François Lepetit. Linked to donors who are starting to ask for a screening of recipients to ensure against corruption and links with terrorism and these kind of activities, and some of the challenges around that which might compromise humanitarian principles. So I think Madame Patricia is able to tell us something about how that is managed in Madagascar, and then if any of the other speakers have something to add, then they can contribute as well. Can I hand over to you, Madam Patricia?
Thank you for giving me the floor. About the data, the protection of data, Madagascar especially has the law to protect personal data, and especially for the program for the social protection, the Ministry of in charge of social protection is implementing a register of beneficiaries and a mapping of actors, and this thing is governed by by one decree. For this register. So about this, the challenging about personal data, Jean Lepetit talked about corruption. We try to establish a numerization of the list of beneficiaries to cut duplication. So I think it's a big challenges for us, and now the government is trying to update the list in the municipality of Antananarivo for deleting this problem of how to say, of corruption for the food distribution. I think that is all for me.
Okay, thank you. I don't know if any of the other speakers had anything to add on data protection and data management, but wave your hand if you do. Okay, so then we'll go on to the next question, which is from Jacqueline Fries, who is working with CashCap in Benin. And this is to any of the presenters, but I'll maybe ask Alketa to respond on behalf of Elia. And Jacqueline is asking, to what extent has the COVID-19 response provided an opportunity to strengthen existing systems for beneficiary identification and registration for use in future emergencies? So Alketa, I'll hand over to you.
Yeah, thanks, Louise. Actually, this is indeed on behalf of Ilir and all the other two municipalities who are part in the intervention, because this has been very widely discussed with the three municipalities. Ilir actually already mentioned that Albania has a centralized system of dealing with emergencies, leaving very small space to the other systems, including social protection, to be able to respond. So this not just COVID, this emergency, but also the way how we responded with humanitarian cash transfer, but also the food package delivery clearly showed the role for the social protection system. So overall, I would say that the pilot itself provided a great ground for revising social protection, including the way how families are identified. The way how families for cash assistance, regular cash poverty targeted cash assistance is identified in Albania is through an electronic system according to the proxy means testing methodology. So basically, you know, there's a very low threshold which very few families are not able to pass, and they qualify for cash assistance. Once COVID started, all systems shut down. So basically, the families that were receiving cash assistance that had graduated in February were the one to continue to receive cash assistance in March, April, and May, and none else would be able to qualify or to apply or to see whether, you know, they actually could benefit from this. So Ilir mentioned that immediately, given that although they had no resources, no legal tools, immediately they reverted to different fora, starting with the local social dialogue group, which is a mixture of humanitarian and non-humanitarian actors. They actually checked all the lists that government has made ready, like the cash assistant, the unemployed, and also they established this, I mean, you might call it a hotline, but was a normal municipality phone line where people would, you know, call and actually present their needs. They also counted this time, which is quite different from the regular cash assistance, on the capacities of the social workers and on the civil society, on their capacity to assess the needs and to refer those households in need to the municipality. The municipality also actually counted on previous, current, ongoing information about families with children in need when they developed this list. So all this process somehow was I mean, improvised, regularized by the municipality day by day. And that's why then the lists were approved in the municipal council and were published the same way as cash assistance or unemployment benefits are published, to make sure that there is enough transparency and enough linkages between the systems. But definitely, yes, it showed something about how also actually overall the assessment of vulnerability in any municipality could be improved by adding this element, by adding social workers and linkages with other actors. Ilir said it already in his presentation, this pilot was really the first, and to that moment, government had always been very, very reluctant, refractory, I would say, about modality of cash. Always the modality of choice legally, but also practically applied, has been food material. So for the first time, we had 2 roundtables, thinking now, what lessons can we draw from these pilots and also from international expertise, and what can we learn about actually adapting and reviewing social protection system?
Thank you very much, Kata. A very comprehensive response there. There's another question for BERCS coming from Lena Gronbach at the University of Cape Town. And I think this is maybe quite a simple question for you to respond to, but she asks whether the main adjustment made was to the payment modality from cash in envelopes to mobile money, or whether there was also an increase in the transfer value or additional payments made to beneficiaries. Over to you.
Okay, thank you, Louis, and thanks for the question posed. What happened was first, it was the change in the modality. There is one was also made. Then the second one was on when you're doing the targeting, we're also discovering some of the elderly and also the disabled who were not yet on the government system, and that list of those has been furnished to the rightful department, which means it will increase the numbers in terms of those. Again, I think what has happened is that with the ongoing COVID response, the size or the amount has been increased. because normally in the humanitarian sector we had used 500 temalangeni or rands, so then now we have topped it up to a 700 temalangan or like that. So it was also the increase in in terms of the transfer value, and also the additional other beneficiaries. Some have been added. I think what happens is that it is not only those who are in the social protection that were targeted, like the elderly, the disabled, but also others who were hit with by the COVID have been put into the system, and then they are benefiting currently.
Okay, thank you. While you're there, Danger and KB, there's another question that has come in from Howard Molle, which I might just address to you. It's for all the speakers, but I'll maybe start with you while you're on the line. And he is asking how humanitarian agencies like the Red Cross in Swaziland and the government collaborated to identify any new beneficiaries due to the new vulnerabilities that have been created or risks that have been created by the pandemic, and whether there were different views between in Swaziland, the Red Cross and the NDMA on who should be prioritized, and if there were different views, how did you resolve that? So I'll ask that to you first, if that's okay. Thank you.
Maybe I can take it. Thank you for the question, Luis. In Swaziland, we have NDMA as a coordinating agency. So firstly, we had several meetings to discuss and agree on the modalities, including the targeting criteria. So when we go out to do the targeting, we already have the targeting criteria that has been agreed upon by all key stakeholders. And then when going to the communities and villages, we then use the existing structures, like leadership structures, so that we make sure they are on board, they fully understand how the targeting is done, and then they support the whole process. And that makes life very easy for us, because when we involve all the structures from the community level up to the higher level at national level, it becomes very, very easy for us. So we simply use those structures, and we don't have much problems so far.
Thank you very much, Secretary General. I'm going to turn to Ilya and Alketa now, just to see if you can also respond to that question about whether the municipality and the humanitarian agencies that you were working with, that you mentioned, UNICEF obviously, how you collaborated to identify the additional beneficiaries that you mentioned, for example, were not fitting within the existing social protection system. And there is another question while you're on the line about monitoring, and whether you can tell us how monitoring was undertaken to ensure that the aid reached those for who it was intended. Over.
Yeah, I can say something for both. Actually, for the first, as I said, the identification of beneficiaries were mainly done locally in the 3 municipalities, because for this particular project, we're interested into identifying those families that were left without any sort of income, be regular income they were benefiting before COVID, be income with the different financial packages that the government established. So this was the key criteria. Of course, if we were to talk more broadly about how to support country overall, definitely UNICEF, UN agencies would have come to with a response that, you know, we go with the socioeconomic assessment and we identify what are the different, actually, the changes in the economy, in the formal and informal market, who are those that are left. I mean, the question could be answered very wrongly, but I guess, sorry, in a longer term, not wrongly, but the scope of the humanitarian cash transfer was mainly to respond to the immediate needs rather than actually wait for these results of the socioeconomic assessment, which is being done in the country anyway. For the post-monitoring for the post-transfer monitoring, yes, we are actually supporting that exercise. We are talking about a small pilot in Korcha, so 600 families in Korcha, 600 families in Durrës, and 600 families in Shkodra. We are doing it through phone surveys. About randomly 1/3 of the families on the list will be telephoned and will be asked, I mean, a simple set of questions. Did they receive, did they not receive? What did they use it for? Were they happy? Were they not happy? You know, what were so was it easy for the postal office to contact them and so forth? So yes, it is, but the results actually are being, it has been completed for one of the municipalities. It will be completed for the 2 other municipalities.
Thank you very much, Alketa and Ilya. Madam Patricia, I'm just wondering in Madagascar if there were issues around how to identify additional populations or people that had new vulnerabilities in response to the pandemic, and whether there were differences in views between the government and humanitarian actors around that.
Thank you, Louise, for this question, and let me use my translator first.
Regarding beneficiaries, there was no problem much with working with our partners, because we know beforehand the criteria. Who are those who have lost their jobs because of the lockdown. And because of that, then there was collaboration with all the actors regarding the meetings that we have each week. What was a little difficulty that we face is about the distributions of those identified people, because the scoring are almost the same. So it was a little bit difficult because the budget was limited, and we have to choose who will benefit. Is that all about the question?
Yes, thank you. And maybe I can just, while we have you there, because there's another question which is very similar, which I will also ask the other speakers to respond to, but it's about whether you are able to estimate how many people were excluded from the response because they didn't fit in to any system and have somehow fallen in the gap, and whether it's possible to let us know whether there is an idea of how many people have been missed out and what types of categories those people might fall into over.
Thank you for the question. The way we did the pre-registration, sort of voluntary registration by those people who feel that they are really in great difficulties during the lockdown. Covered beneficiaries then 50 to 70%. It means that 30 to 45% is the gap. that the government tried to fill in through food distribution. So the government is looking at it now so that everybody could receive aid. Those who are in difficulties could benefit from aid. Thank you.
Thank you. I don't know if any of the other speakers want to also talk about groups who have potentially been excluded. I think we've lost the video for danger. Okay. Let's move on. We don't have time for too many more questions, but we can be responding to them in writing at the end. But maybe just one, as the focus really of this webinar is on the role of local and national actors in terms of the response and linking humanitarian cash and social protection. And so a question that has come in from Corey Stedman from the Grand Bargain Localization Workstream is around the major role that local and national actors have played in terms of responding to this major crisis in terms of the pandemic. And she asks whether this is normal or usual practice in your countries, and what have been some of the biggest challenges as local and national actors in taking on this lead role if it's not normal practice. And just another element to that question is, how can international donors and international aid agencies better support your responses now and in the coming months? So Alketa, can I start with you? And then I'll move on to Madam Patricia. Thank you.
Sure. Now that's a very actually good, relevant question, because this is a question we're all struggling. Ilir said it, it's actually unprecedented for all of us. Albania, in March, I mean, when the 2020 started, we were just after a major earthquake, end of November 2019, which actually left homeless about almost 12,000 people. So that was quite a major disaster. I mean, the first in many years that Albania faced. And as I said, we started to advocate with the government to start with, cash transfers, responding to emergency a bit differently from, the usual giving a blanket and this hot soup and the rent subsidy. And it was a no-no. At the time, we actually advocated very strongly with different humanitarian actors, especially International Federation of Red Cross, and developed even a humanitarian cash transfer working group, which was kind of regularized in February. So when COVID started, somehow it found us a bit prepared in that regard, and we immediately mapped all the organization, what we're doing in terms of food and material donation. Also went ahead and proposed some standard operation procedures in case different donors would go for humanitarian cash transfer. Albeit this was not taken very well, because not taken very well, it was very much appreciated, but it didn't guide actually different donors when they piloted, because there were only, except UNICEF, there were 2-3 NGOs that piloted very, even much smaller than what we did with Korcha and the other 2 municipalities. I mean, they, were confined with amounts of funds, with timeline. So SOPs, while everybody said this is fantastic, this is what we need, the adherence to those SOPs were missing. So this is something, this was a plea that we put forward to all the donors in the country. Somehow, it's my personal a bit kind of take on the epidemic so far, is that when this started in March, we all were under the assumption that this is temporary. Okay, we'll face the lockdown. people will lose income for 2-3 months, then country will open up, things will come a bit to normalcy again. This is not happening, and actually the poverty will hit much harder in fall, much harder in winter. So while actually the mindset, at least in a country, upper middle income country like Albania, while the mindset was okay, we can intervene with some humanitarian cash transfer for a very short time, I think there is need to actually think it a bit better and longer term, up to maybe I would say really next spring. World Bank is actually estimating, they've done poverty simulation, 40% of population will be poor in Albania in autumn. So while long-term discussions will happen to actually change social protection systems, there is definitely need to link this longer-term development with humanitarian cash transfer. There is need to build capacities in the country about understanding and actually implementing that. So this is, sorry, because I know the question is global, but I'm talking about what we face here in Albania. And Ilir also said it, the families also are saying, well, 4,000 lek, which is about, let's say, $38, is fantastic because they could, meet their basic needs, and a food package doesn't meet their basic, properly specific needs. They get more dignity, they get more freedom. I'm preaching to convert it here. So, and so Ilir said it, families also, they wanted some predictability, some longer term support. And the development of social protection system will hopefully come. This is all, we hope. This is all we fight and struggle and advocate. But humanitarian cash transfer is definitely needed to fill this gap for the next at least 3 to 4 months.
Thank you, Alketa. So I'll just ask, we'll just do this final question before we wrap up. So Madam Patricia, the same question about the role of local and national actors in responding to crises, and whether it's usual for them to take a lead role, and if not, what were the challenges, but also what can international donors and international agencies do to help support these types of responses in the months to come. And then I will move on to Danger and KB to answer the same question. Thank you.
Thank you, Lois, for this question. Please answer. Ni avantage ni
advantage program in Madagascar, we have this cash working group that have started in 2017. It has worked since that time. And all the actors within that cash working group, they know one another. Especially those who are working for cash transfer. Want to speak about World Bank, World Food Program, UNICEF. The only challenge, there are some actors that are not really following the rules that the government has set regarding the coordination. So we are doing our best in this cash working group to set the harmonization. So this COVID response enable us to really embed that. And it also allowed us to work with other partners like the Red Cross, the UNDP, Humanity Inclusion, or other stakeholders that are doing cash transfer. That has enabled us to have common tools, whether it is that identification of the beneficiaries, and up to the communication, that is common communication, and MNE, that is common MNE tools. The challenges that we have faced now is to need to have other actors on board so that they will be working with us so that we can have better results. The existence of those partners financing cash transfer in Madagascar is making it easier, this coordination. The effort that we will undertake is the mobilization of funds, leveraging funds from other partners through the result of the evaluation that we have had regard to a program of cash transfer. That we have seen that we have better results from cash transfer in Madagascar. That's what I can say.
Thank you very much, Madam Patricia. And we just have a couple of minutes left. I don't know, Secretary General Nhlabatsi and KB, if you had anything to add about particularly around the support that you might receive from international donors and agencies in terms of ensuring the lead role of local and national actors in such crisis responses.
Thank you very much, Louise. From our end, what we think the kind of support, first it will be in terms of how we can work around improving the systems and the government, like the policies. Some of them might need to be upgraded to incorporate more in terms of what we envisage to do around social protection issues. Then, for example, like linking them with the humanitarian or like the shock responsive social protection. So we work around the policies to incorporate that for vertical or even horizontal expansion of the program. Then secondly, it will be capacity building around the key players in that, so that we'll be able, whatever systems that we have put in place, we are able to work with them and we have the capacity to utilize those systems. Then maybe lastly, it will be availability of funding, so that we test the systems that we would have upgraded and we put to use the capacities that we would have built. So that at least in the government, more so to, when you don't have the funding, as much as you can have the systems and the capacities, then you don't know whether they are working or not. So I think also the issue around the funding. I think I liked what Alketa said in terms of we did not have a foresight to say COVID is not just a temporal thing, but it looks like it's a long thing. So to think long term will also assist us in terms of seeing that what systems we need to upgrade, the capacities that we need to build, and the availability of funding, so that we address some of the things that about COVID-19 are evolving. So they change now and then. So we need to incorporate whatever the changes, and then we need to be able to respond to the changes that come with the change in COVID responses.
Okay.
Thank you very much. And I have an eye on the clock and we have run out of time, but I would like to very much thank all the speakers today, as well as those who've attended. I think the examples that we've heard about have really highlighted that actually linking humanitarian cash and social protection is a very complex area of work, but it is an essential area of work if we are going to be able to address the needs of those who have additional vulnerabilities or are at additional risk of crises such as the COVID-19 pandemic. And the preparedness work required here in order to strengthen systems and ensure the ability to respond and scale up horizontally and or vertically is really essential. And hopefully we can all build on the learning that we've heard today coming from Madagascar, Swaziland and Albania. So thank you very much, Mr. Zguri, Secretary General Nhlabatsi, KB, Madam Patricia and Alketa, as well as the translators who we don't see, but thank you. And I wish you all a good day, evening and afternoon ahead. Take care, everybody.
Oh my God. Huh?